With 1 in 4 people suffering from a mental illness at some point in their lives, alongside an alarming upward trend both globally and in Sri Lanka, the need for high-quality mental health care solutions is now more critical than ever. This trend is the result of a vulnerable mental disposition caused by genetic and environmental factors, which include increasing levels of psychological stress and unhealthy lifestyle habits. The relevance of a holistic treatment plan, which addresses the biological and psychosocial aspects of brain pathologies that cause abnormalities in mental state, has never been greater. However, the general lack of awareness among the public and related social impact which accompanies mental illness has created the need for an impartial solutions provider with the ability to offer accessible, evidence-based treatment. Further, NCMH acts as a promoter of mental well-being and overall awareness-raising agent in the community. Established in 1982 by Professor Nalaka Mendis, the National Council for Mental Health, Sahanaya, is a not-for-profit organization dedicated to the mission of best managing mental illness in the local communities. Sahanaya was established under an Act of Parliament, positioning the organization as a unique entity amongst other registered charities. Given its long-standing tenure at the forefront of the sphere, Sahanaya has positioned itself as a highly accessible organization, working closely with the state as well as the private sector, while continuing to provide an inclusive method of obtaining treatment for the general public. Governed by an elected, independent management committee and supported by an actively committed group of volunteers, the organization has succeeded in contributing to a wide spectrum of issues related to mental health and its policy. To this effect, NCMH has often been involved in the process of national health policy formulation and subsequent implementations.
Sahanaya, or the National Council for Mental Health, was established in the early 1980s to fulfill the need of the community. So we responded by establishing a community organization called the National Council for Mental Health, which provided rehabilitation for the long-term mentally ill and also raised the awareness among the communities by way of mass media, television, newspapers, lectures, seminars, workshops, to raise the awareness about the mental health issues in our people. And with that, of course, we got many people involved in the activities, and it was a community organization where caregivers, the families, the neighbors, the volunteers, the funding agencies, the universities, and of course the government agencies were involved in supporting us and working together with Sahanaya. Over the years in the 1980s and the 90s, and of course the early part of this century, expanded very much with the help of the people, essential to raise the facilities and also facilitate the development of other organizations in Sri Lanka, which would work with Sahanaya and also independently.
Currently, NCMH operates 2 fully fledged facilities in Colombo and Gorakana, where a comprehensive range of therapeutic services are made available to patients, often referred to NCMH by psychiatrists practicing throughout the island. In addition to its primary function of aiding the community and ensuring its overall well-being, NCMH has partaken in a number of support initiatives. Initiatives such as conducting trainings and workshops for healthcare professionals, students, the military and corporates, publishing of books in native languages of Sinhala and Tamil to make information more freely accessible, as well as general awareness building campaigns are carried out to the Colombo facility. Further, the Colombo facility provides outpatient counseling and a vibrant rehabilitation program for those recovering from severe mental illness and caters to their psychological requirements in the most suited.
Advances in neuroscience Genetics, psychopharmacology, and psychological therapies over the past few decades have revolutionized the diagnosis and treatment of mental illnesses and disorders, which have become increasingly prevalent in today's society. The National Council for Mental Health plays an important role in promoting awareness on all aspects of mental health, which include community mental health, mind-body interaction, and the importance of delivering a holistic treatment package to all our service users. Sahanaya strives to promote strategies that are linked to prevention, early detection of those suffering from mental illnesses, and the use of evidence-based physical and psychological therapy that give rise to rapid rates of recovery and social reintegration. We understand that homegrown problems require homegrown solutions, which should be sensitive to prevailing cultural, religious, and other socio-economic factors in Sri Lanka. This is clearly demonstrated by the novel therapeutic interventions that have been adopted by our residential facility in Gorakana, which aims to foster responsibility, awareness, and discipline, which are particularly important to our younger service users.
The future objective of the organization is to ensure accessibility to the outskirts of the country where the requirements of psychological help is direly felt. Furthermore, the NCMH is committed to assessing the mental states of the population through a research-driven approach to gain a better understanding of high-risk groups and influences in advance to drive preventing measures. The formulation of holistic treatment plans encompassing complete well-being of mind and body to address disorders that show an increase in prevalence is also a key priority of NCMH.
Gorakana Center, medication is provided by consultant psychiatrist and a visiting consultant psychiatrist who visits once a week, and the nursing care is handled by a resident matron and a residential nursing panel. And the psychological therapies are provided by psychologists, occupational therapists, and volunteers. Art therapy, dancing, music therapy, computer, horticulture therapy are some of the psychological therapies by the professionals. The main goal of this institution is reintegrating patients into the society and improving the quality of life of them.
NCMH has been awarded many laurels by governing state bodies for excellence in service quality and is staffed by a qualified group of professionals committed to the cause of mitigating mental illness in the country.
From my childhood, I've always been hearing about Sahanaya, primarily from my grandparents who were involved in Sahanaya. My grandmother was a part of the original volunteer corps of Sahanaya, and therefore it's a privilege for me to be a part of Sahanaya today. I think the secret behind Sahanaya is the good people who've been behind it from its inception up until the present day. From Professor Nalaka Mendis, who started Sahanaya, to the present management committee headed by Dr. Nirosha Mendis. The challenge now is how we take Sahanaya into the future. And we have now come up with a 7-point plan, an ambitious plan, which we hope to implement in the next 2 years. 3 of these 7 points focus on research and development in this area, strengthening international links, and creating awareness beyond Sahanaya's centers in Borella and Gorakana, which are already well established now. So I appeal to like-minded individuals to come and help us in this task, to get involved in Sahanaya, to see the work we do, and to take Sahanaya into the next era.
Affiliations with foreign bodies such as the World Association for Psychosocial Rehabilitation and other professional bodies in the field of psychiatry have provided great support for the organization. and enable the staff to be in touch with developments of the field on an international level.
දැන් මගේ මාස 3ක් වෙනවා මගේ පුතා සාමාන්‍ය තත්ත්වයට පිටියට වැඩි සාමාන්‍ය තත්ත්වයටපත් වෙලා ඉන්නවා. මේ ආයතනයේ කරන හැම සේවයක්ම ඉතා හොඳින් කරනවා කියලා මට හිතෙනවා. මොකද මම සතියකට වරක් මේ ආයතනයට ඇවිල්ලා මගේ පුතාව බලලා යනවා. මම බලාපොරොත්තු වෙන්නේ පුතාව හොඳ තත්ත්වයට ගන්නයි. ඒක ගොඩක් හොඳට මේ ආයතනයේ සිද්ධ වෙයි කියලා මම බලාපොරොත්තු වෙනවා. ගොඩක් හොඳ සේවයක් කරනවා කියන එක මම කදිම කියා සිටිනවා මේක හොඳ ආයතනයක් බව. මේ ලොකු සේවයක් මෙතනින් කෙරෙනවා. ඒ ගැන අවධානයෙන් හැම රෝගියෙක් ගැනම අවධානයෙන් මේ අය සේවය කරනවා කියලා මම කියනවා.
The future of mental health is an area of great interest both globally and within the country. The rapid economic development experienced by Sri Lanka has created great interest in psychological health. And to this effect, Sahanaya is geared to contribute to the complete well-being of the nation and its people.